Hello everyone, good evening everybody. I'm Priyanjali from Radiance with You YouTube channel. I'm sure all of you must be keeping good health. Today we are talking about the essential role of moisturizers in managing dry skin disorders like eczema, psoriasis or simply dryness. If you are struggling with dry skin, you are not alone. Moisturizers are key to keeping your skin healthy and comfortable. Dry skin happens when your skin loses moisture and can't retain enough water. This leads to rough, flaky, and sometimes itchy skin. Conditions like eczema or psoriasis make this even worse by damaging the skin's natural barrier. We are going to have an important chat about them and how we can stop them from spreading by taking action early. Don't worry, we are not just here to talk about the problem, we are here to talk about what we can do about it. We'll look at how to manage dry skin from happening and talk about the latest treatments. So let's connect today with our skin expert, Dr. Harsha Sarawgi. Is an MBBS, MD Dermatology, Venereology, and Leprosy. She's a life member of Indian Association of Dermatologists, IADVL. She is currently associated with Skinovation. She is a chief dermatologist founder of Skinovation. Throughout her career, Dr. Harsha Sarawgi has contributed significantly to the field of dermatology, aesthetic, and psychology. Her commitment to advancing the understanding and treatment of various skin conditions is evident in her extensive body of work. Dr. Harsha Sarawgi, live from Kolkata, to talk about moisturizer's role on dry skin disorder. Dr. Harsha Sarawgi, with nearly a decade of experience in offering world-class dermatological care to all her patients suffering from skin diseases. Dr. Harsha is truly a patient-focused dermatologist, and today we have her here with us. It is pleasure to host you, Doctor. Over to you with the first question, which is, what are the common causes of dry skin?
Thank you so much for the very kind introduction to the team Radiance with you and Priyanjali especially. I'm very glad to be on this platform today, and I'm sure with the talk that we will be having over the past half an hour to 45 minutes, we can cover skin issues, especially related to dry skin disorders, and talk about moisturizers specifically. And I'm sure by the end of this session, the people who have joined us will benefit maybe a little but significantly in the stream of dermatology and to understand what is going on behind the scenes and how we can
Okay, we are sorry for the network. We will get her back. Uh, Joining us once again, everybody. People who are joining us, who has just joined us, thank you so much, everybody, for joining today's live. Today, we are going to talk about the role of moisturizer on dry skin. Also, it's summertime, almost summertime, and we will also talk about how we can take care of our skin during the summers as well. Because mostly, what people think is our skin is supposed to be only treated or taken care of during the winters. But we will today know if our skin is also important to be treated or taken care of equally during the summers as well, and how we can take care of it in the coming days, where weather will be changing drastically. So a lot of regions nowadays they are still facing winter. It's still cold there. Also regions like where we have our doctor from Calcutta, and it's almost nearly summer reaching at Kolkata. So weather is drastically changing at all the places, and we need to know how to take care of our skin. We are trying to get back. We
okay.
have her once again back on the connection. Doctor, can we continue with the question? Yeah. So the question was, what are the causes of dry skin?
Talking about dry skin and the causes for it. So let's just say that dry skin it's actually called as xerosis medically. It could be localized or generalized. Now, localized causes could range from cases like eczema, psoriasis, and even different kinds of localized allergic contact dermatitis or irritant contact dermatitis. Other than this, there are very different causes which are generalized causes of dry skin. It could be as simple as environmental factors like low humidity and high exposure to sun. Even staying in AC and closed environments for a long period of time causes stripping away of the natural moisturizer from the skin, so it can cause dryness. Other than this, there are various lifestyle factors like if you do not consume enough water, as simple as not consuming enough water, actually dries out the skin significantly. So, this is another very common thing that we miss out on a daily basis and actually causes dry skin. Even over washing your skin, for example, if someone has a habit, you take a shower in the morning, again in the night, and more than that, sometimes in a lot of people, it actually strips out the moisturizer every single time you take a shower. So simple things could actually make dry skin. These are simple things, but there could be something more than just skin deep. Sometimes even thyroid issues, things like diabetes, actually cause dryness in the skin, and we don't know and we don't realize it until we consult a doctor and we get to know that this is the cause of dry skin. Even something like aging, actually, it depletes all the natural moisturizer from the skin and causes a lot of aging and dry skin issues. Sometimes occupational factors like hairdressers, farmers, even nurses and doctors have dry skin issues because of wearing continuous gloves. For example, for nurses and for doctors, it every time we wear a glove, there's a tendency to wash our hands after we've done that particular procedure or work. So regular washing of the hands causes dry hands, and that's a very common thing. Even other factors like medications, for example, if someone is on oral retinoids or other medications like diuretics and all, it it takes down the water from the body and causes dryness. So these are very simple things. Some of these could not be picked up by the patient, but all of this as a amalgamation causes dry skin in different people for different causes. So you have to actually think about it, consult with your doctor and understand the cause of the dry skin. Only then can you treat it. It's not just about dry skin, it's about knowing the cause of the dry skin. In
Hmm.
different patients it's different, but yes, you have to know it so that you can treat it the best.
Right. Now, as uh, as you have already mentioned, there are a lot of things which we need to take care of when we are talking about dry skin. But doctor, if we can make it a little simple for the viewers, um, what can be the most basic and the most simple thing one can do in order to stay away from dry skin?
The most simple things are actually not the simple things that people follow. So the most simple thing I would say is to drink enough water. It is one of the simplest thing that you can do. And when you drink water on a regular basis at regular intervals during the day, you'll realize that your skin receives that hydration and becomes much better. So this is one basic thing that you can do. The next is to not over wash your skin, because we as humans have the tendency of feeling that our skin has become it has become it's lost that glow and things like that, and people feel that they need to wash their skin even more frequently than usual in order to gain that kind of suppleness or things like that, and in that way they actually lose more moisture than it's required. So I would say that don't over wash your skin. Make sure to always use a moisturizer post you wash your skin, because the best time to use a moisturizer is just after you've washed your skin. So just pat
Hmm.
dry your skin and then use a moisturizer. A basic routine that I tell to all my patients as to how and when to use the moisturizer, so that that simple life change, like a lifestyle modification, like I say to my patients, what they can do
Hmm.
is that firstly, make sure to not over wash your skin in the morning. Stick to just 3 minutes of shower for the max, not more. not more than that, because more than that actually strips off the moisture from our body. Pat dry the skin post you have taken the shower. Do not use uh, very harsh towels to clean and dry your skin, because it's not needed. Pat dry is more than enough, so just do that. Pat dry. After you've pat dried your skin, make sure to use a nice emollient, a moisturizer which is in the form of a lotion, which uh, s- actually it kinds of forms a layer and a barrier on the skin, as well as hydrates the skin from within. So both of these factors are important. Whatever moisturizer has happened to the skin because of that hydration from the shower, it's going to stay there, and also it's going to absorb the moisture from the atmosphere. So choose a lotion based moisturizer and properly seal it all over your body, so that all that moisturizer
Hmm.
stays and you get more hydration from the environment as well. So these are few tips and
Right.
tricks that I always tell my patients.
Right. Now, doctor, if we see the early practices, I know a lot of people who has a habit of applying oil before they go for bath. They'll apply the oil, they keep it for some time, they sit under the sun. I mean, people early in the early times, they very frequently maintained or believed such practices. Uh, Nowadays, we gradually see people not using such things. Maybe because of time, they are people does not have so much time that they'll apply oil and then they'll give them a bathe. That's not possible all the time. But does those things work? Is it okay if somebody they are thinking of following such practices which has been used early?
I'll say that the skin and the environment which was there for our parents and our ancestors isn't the same now.
Hmm.
There's so much of
Hmm.
pollution. So when you talk about going outside in the sun and sitting, we don't
Hmm.
realize, but more than the sun, there's a lot of
Hmm.
environmental pollution which is there. So you're
Hmm.
exposing your skin to so much of environmental pollution, so much of sun damage, because you know that there's vitamin D because of that sun exposure, but there are other ways to get your vitamin D which are much safer and better, because a lot of
Hmm.
sun exposure causes a lot of skin aging. So I
Hmm.
generally wouldn't recommend any of my patients to do those kinds of practices. Also, talking about oils, now our ancestors tell us to apply oil in the skin, but there are so many studies and so many
Hmm.
data which say and which have proven that especially mustard oil and a lot of other oils are not good for the skin. They cause certain allergic reactions like allergic contact dermatitis and irritant dermatitis, which are skin issues just because of using those kind of a mustard oil. Because even these oils and all, they have so many things added just other than the oil. You really don't get that original um, purified versions of these nowadays. There's so much more added to it, so I never recommend it. If you really want to use a oil, the only oil that I would still recommend, it's not the best way to moisturize the skin, but still a virgin coconut oil is something that still can be used, specifically for
Hmm.
people who they have that habit of using oil and they really can't get over it. They want to use
Hmm.
something which is more natural. They can go for a virgin coconut oil for the body. Again, not for the face, because it's too greasy
Right.
and it actually can clog the pores of the face. For the body,
Hmm.
it's still okay. But other than
Hmm.
that, I don't think I'll ever be able to recommend anything else to any of my patients.
Well, perfect. Also, because we are talking about people using such practices or believing in such practices, let's also not miss the toddlers or the very infants. We still see that they will bring dyes or people who are specialized in such massages. Let's talk about regions like South India where such practices are still believed. So, Doctor, tell us, are those practices actually useful for an infant or a toddler?
I'll just say that a lot of things have been done since so many decades and years,
Yes, doctor, we
and
can
we've
see.
all
Yes.
been hearing it and we've all been grown with it. So there is some logic behind it,
Hmm.
but some people really go too much way ahead than it's needed. Like using a little bit of the coconut oil to massage your child is okay for toddlers, but
Mm-hmm.
don't go way ahead, really,
Mm-hmm.
massaging them in a way that it damages and harsh massaging and things like that really actually they degrade the skin barrier, and sometimes later on these patients develop certain skin conditions just because of that harsh massaging which has been done, and it's kind of degraded their skin barrier. So don't go too much way ahead with these treatments. Little bit of moisturizing is very good. There are so many good moisturizers available even for toddlers nowadays, which are safe to use in children, which have data, which have a lot of scientific study. So rather than using something just kitchen based like a mustard oil for your child, I would say that there's so many more options. Our mothers and ancestors didn't have those options, so they used all of these. But in this 21st century, if you still stick to all of that, when there are so much better alternatives, I don't think I'll recommend it to my patients. There are much better products available at the moment. So I'd suggest them to always consult a dermatologist, even for the toddler,
Mm-hmm.
know what's good for their skin. Also, toddlers also have different kinds of skin issues. They have diaper dermatitis because of regular diaper changing. So these issues were not there before so many years because there was not so much of an idea of
Mm-hmm.
using a diaper. So there's so many different issues
Right.
which are coming up in the 21st century. So we cannot stick to the things which our ancestors did, right? There's new
Mm-hmm.
issues. So there are new solutions to that. So I'd suggest that always consult a dermatologist, because that's the best way to know what's good for your child and have enough proven data for all the products that you are using for your child. And just don't use anything out of that kitchen counter just because it's easily available. You have to choose good
Right.
things for your child.
Right. Right. Absolutely, doctor. Quickly moving on to the next question, doctor. How common is dry skin associated with acne and atopic dermatitis?
Okay, so we'll take it one by one. Acne and atopic dermatitis. Now, talking about acne, a lot of people believe and they have a myth that acne is oily skin, and oily skin means I don't need a moisturizer. But what you need to understand is that acne is a condition in which the skin barrier is actually defective. That means that if your skin barrier is defective, you need to repair that skin barrier. Also, when we treat acne, a lot of the medications which we give for acne cause localized skin dryness. So, in order to combat that dryness, you have to moisturize your skin well. So, no matter whether you're on a treatment or you're not, both the cases you need to use a moisturizer. Of course, you can't use any kind of moisturizer because acne is a specific entity which has to be dealt very separately than the rest of the skin diseases. So you'll
Mm-hmm.
have to use a gel based moisturizer uh, because it's very lightweight and non greasy. But the best is to consult a dermatologist and choose the moisturizer, because even in acne, sometimes it's a combination skin, sometimes it's acne but dry skin, sometimes it's acne with a lot of sebum production. So it depends on what kind of a skin you have in order to choose the best product out of so many over there. Definitely don't use products which contain fragrances, because it's not good in an acne prone skin to use fragrance filled products. Next, talking about atopic dermatitis. Now, atopic dermatitis, people who have it and know they have it, really, it's an association of a lifetime with a moisturizer,
Mm-hmm.
because no day in an atopic dermatitis patient can you skip a moisturizer. There, you
Mm-hmm.
cannot live a day without it, because as soon as your skin becomes dry, your atopic dermatitis is going to worsen. So it's not just the moisturizer, it's about the quality of the moisturizer. In atopic dermatitis, you need a really heavyweight moisturizer, something which goes inside the skin, it moisturizes it well, and it actually hydrates the skin from within. Also, you need
Mm-hmm.
something to top it up as an occlusive in order to maintain and retain the moisture which has been locked into the skin. So you
Mm-hmm.
need to use a really good moisturizer for an atopic dermatitis patients. Some patients have certain patches because of atopic dermatitis. So they will need specific localized treatments other than just the moisturizer too. But moisturizer is something which is the it's just like how you eat food every day. Your skin has to be moisturized every day in case you have atopic dermatitis. There's no way you can skip it.
Right. Because we are talking so much about atopic dermatitis, doctor, tell us a little bit more about it. How does it look like?
So, atopic dermatitis, it is a presentation which can develop at any age during the patient's lifetime. It could be young age, it could be mid age, or it could be even older patients. So, depending on the age that the patient develops atopic dermatitis, the presentation can vary. For example, in a toddler who's a crawling baby, it usually develops over the extensors because that is the area which is more prone to frictional dermatosis and more prone to, the child crawls. So, these areas are more involved. But for mid age patients, it mainly the flexural areas like the elbows and the knees,
Mm-hmm.
and the older patients can develop patches in any parts of the body. So it actually depends on the age of the patient also. It
Mm-hmm.
could be a mild atopic dermatitis, something that is not too worrisome for the patient, whereas some cases can be really flared and it could affect the entire body. It could really cause redness, itching, burning, sometimes even cracks and fissures in the skin because of atopic dermatitis. Even to these patients, certain professions don't suit. For example, you cannot really be a hairdresser, you can't be a full-fledged farmer, you can't really be a nursing staff who's exposed to chemicals, you can't work in a chemical industry. So
Mm-hmm.
atopic dermatitis patients are really tough to handle because they have to make a lot of lifestyle modifications. They cannot skip the moisturizer, they can't be in too harsh environments like too much of sun exposure, too much of cold will really aggravate the skin. So, and they always have to wear full, I always suggest them to wear full clothes as much as possible so that their skin is hydrated well. And when you wear a cloth above it, it actually locks in the moisturizer. So they have to do a lot of changes. It has to be an everyday effort to make your skin soothed and hypoallergic, because as soon as that atopic dermatitis flare starts, your skin itches a lot. So it's very difficult for deal with those
Mm-hmm.
kind of issues when your skin is really itchy. So it is an
Right.
everyday.
Right. So, this atopic dermatitis, which we are talking about again and again, doctor, tell us, is it a skin condition, or it can, occur at any point, or there is any particular trigger for it?
Okay. So atopic dermatitis is a particular skin entity. It is a disease condition of the skin in which the skin does not have the natural barrier that we usually have. It can
Hmm.
develop in any and every person, but there are certain predisposing factors. For example, genetic factor. If there's a mother or your father or any of your grandparents who had atopic dermatitis, there's more
Hmm.
chance that you'll develop it. If you have a sibling who has atopic dermatitis, there's a higher probability of you developing it. So that's a genetic predisposition. Otherwise, also atopic dermatitis can happen sporadically, like we say, without any genetic history, but it can develop in a lot of patients even otherwise. So there are a lot of factors, also environmental factors. Sometimes you have a predisposition and then it gets aggravated because of environmental factors. So there are different reasons why it can happen, but yes, it can happen to anyone and everyone. It is not something that it cannot develop in any particular person, but some patients have a higher chance of developing it, the other patients have a lesser chance of developing it, and some patients develop it not in the initial years. Some patients also develop it later, like after 50 years they see that now they have this tendency. So it depends on a lot of different factors.
Right. Now, doctor, tell us, how does the initial stage look like? If somebody would want to identify the condition in the initial stage, and tell us that, is it also treatable in the initial stage if the person is planning to take good care of it in the initial stage? Can it be possible that within a month, a few months, or a year or two, maybe it can come back to a normal state?
So initially, if you see that your skin is very itchy or your skin is very dry, that is, I think, the first and initial marker. You feel that certain parts of your body are much more itchy than the rest of the skin. So that is the first factor that you should consider, and that is the point when you should consult your dermatologist. It's best to consult a dermatologist at that stage because it's the initial stage, so it's easier to treat it at that moment. As soon as you start making these changes, for example, even for your daily bath, don't use a cleanser which has a lot of fragrance and things like that. Choose a very, very mild hydrating cleanser which is hypoallergic, non greasy. It is not very foamy in texture. Uh, because fragrances, we don't know, but sometimes even fragrances can aggravate atopic dermatitis. So, you can't use all of those fancy fragrances that you find. So, these lifestyle modifications they've done at the initial stages, which will be suggested to you by your dermatologist, it can actually slow down that process. I'm not saying that it will completely get resolved, but if you follow all of this over a period of 2 to 3 years, you'll see that it's not getting aggravated and somehow it's under control. So it's just like some lifestyle modifications in order to improve the skin condition. And once it's good, you can just maintain it. It's not that you'll be off moisturizers in an atopic dermatitis case. You'll always be on moisturizers, but you'll not see those flares and you won't see that your skin condition is worsening. So it is a
Right.
maintenance treatment.
Right. Whenever we are talking about our skin, we know that it is something we need to be consistent with. We need to maintain it throughout our life. If you're willing to have a good skin, the skincare you are following or the regime needs to be on a regular basis. Daily, you cannot miss your days. You have to remove your makeup every day. So these are a few of the basic things we need to take care every single time. You cannot miss on that. Doctor, and now speaking about the skin, you said that not applying moisturizer or being exposed to the sun for a long time can somehow lead to dry skin or formation of wrinkles or aging, which you mentioned. Tell us the role of sunscreen as well. How important is using sunscreen for us? Can not using sunscreen also lead to dry skin at times?
Sunscreen is as important as you eat your food. If you skip your food a particular day, you can skip a sunscreen. But if you want to eat food every day and want to drink water every day, you have to apply sunscreen every single day. Because no matter whether you're at home or outside, whether you're having a direct sun exposure or not, there's always some amount of sun exposure to all of us in some way or the other. So you have to use a sunscreen. It's a mandatory in today's world because sunscreen has so much of data about anti-aging, about not only sun protection but even hydration. Because nowadays the sunscreens which we have are so much advanced, they have so good formulations that not only do they protect you from the sun, but they actually also moisturize your skin so well. So you have to use a sunscreen in certain patients. In fact, if you have a very, very strict routine that you can't do too much to your skin, I just tell them that wash your face and use a sunscreen. I give them a hydrating sunscreen so that they don't have to use a moisturizer extra. But then it's so good. Like nowadays there are so many formulations of sunscreens. They are silicone based sunscreen, there's a gel based sunscreen, there's water based sunscreen, there are sunscreen lotions. So there's a lot of options. If there's a particular sunscreen that you don't like, you can talk to your dermatologist. I think that's the best way to do it because sunscreen is something that you will be using on an everyday basis. So choose a sunscreen which you like because you have to use it every single day. It's best to reapply your sunscreen every 2 to 3 hours and use enough quantity of sunscreen for your entire face and your neck. Never skip your neck because we sometimes feel that neck is not so important and we don't apply sunscreen over the neck, but it's equally exposed to the sun. So don't skip your neck. Also, if you have certain exposed parts of the body, then apply sunscreen even on those parts because no matter you realize it or not, But when you get your nails done, or when you have a lot of when you travel a lot, your hands get exposed to the sun so much. Even that UV ray
Mm,
in that nail art counter actually damages the skin over your fingers and your arms and your hands. So you have to use a sunscreen even before going for those procedures. So there's no way you
mm,
can skip a sunscreen. It's something which is like your food. It's a food for the skin, and it's an anti-aging for the skin. You have to use it.
right. Now coming back to moisturizers once again, doctor. We now know that according to seasons, our skincare regime should be not changed, but taken a little here and there, because winters definitely need a little bit more caring. You have to care for the skin a little bit more, maybe because of the dryness in the air. Or during summers, the regime can be a little different, or you can add a thing or two, or just minus a thing or two from your daily skincare regime. So, now that summer is coming, how important is moisturizer during the summers as well? If yes, if it's really very important, what kind of moisturizer should one add in their regular regime?
Okay, so talking about your changing of the skincare, it is important because we all know that in winters the skin is very dry, and therefore you have to use a moisturizer which is little more hydrating, something which actually makes your skin feel supple. But in the summers, because of the humid weather, sometimes in certain areas these are dry weathers in summers also. So you need to modify the moisturizer a little. For example, if you're staying in an area which is very hot but the weather is dry, you have to use a moisturizer which hydrates the skin, but it doesn't bring out so much of sweat and things like that. In areas which are more humid, sometimes you need to stick to gel based moisturizers, because gel based moisturizers don't bring so much of sweating in the skin, and in humid weathers there's more chance that your skin will become very much sweaty in the summers. So you have to
Mm-hmm.
choose a moisturizer. Don't go for any greasy preparations, like don't go for preparations which contain too much of oatmeal, or also things like shea butter, mango
Mm,
butter, or things like that, because those are too hydrating for the skin, and it can actually make your skin very sweaty in the summer season. Stick for gel
mm,
based moisturizer, something which actually melts into the skin and gets absorbed completely, because in
mm,
summers you want something which is lightweight, you want something which is
right.
hydrating but not greasy. So you have to look
Mm,
into the moisturizer.
right. And what apart from the moisturizer, doctor? We now know that people are widely using all those things, all those products which are available in the market. Definitely, they bring good results to our skin initially, but again, we don't know if it's really important for us or if one should use it. Just by looking at the influencers or the ads nowadays, so fascinating. It looks fascinating that we want to use it. So, or maybe just following a friend of yours uh, who is actually using those products and it's working for him or her. So, whatsoever the reason is, we see a lot of people nowadays using 10 steps of skincare regime, 8 steps of skincare regime. There are steps which they religiously follow. So, are those important? Or if it's important, what are the basic steps which one can or one has to, take in on a daily basis?
Okay, so there are too many questions in this, taking up one by one. Talking about steps in skincare, it's not mandatory to follow a 10 care skincare routine, because me being a dermatologist, I also don't follow so much. You have to be very practical. Consistency is the key. It's not about using 10 products, using 10 things on your skin. It's about using the
Mm,
right products in the right quantity at the right point of time in the day, and choosing products which you can afford. Sometimes people follow these influencers and they buy one or two products which are too expensive and they can't follow it up regularly. You have to choose products which you can follow consistently and do it for the rest of your life, because skincare is not something which is a one day thing. It is going to be there for the rest of your life. So you have to choose products very wisely and follow it diligently. The basic skincare is a face wash, like a cleanser, whatever cleanser it might be, suggested by a
Mm.
dermat, moisturizer, the sunscreen, and serums, just in case you have any particular skin issues. Other than that, in case you have certain skin concerns, there's always additions which can be done to this basic routine. But this is something which is just like a basic skincare, a face wash, a sunscreen, and a moisturizer. This is something which has to be done with every single person, just like how you have your food and you drink water. This is something which your skin needs, and you have to follow this basic skincare.
Right. Now,
Also,
speaking of, yes, please. Yes, please.
also, like you were saying about the influencers, I'll just like to tell
Mhm.
that we get carried away because of that nice marketing strategies that they use. But do you really
Right.
feel that every week that influencer coming out with a new product is going to use that on the skin? Most of the times it's not true. Most of the times it's not true. What they're also
Mm.
using is a skincare routine suggested by a dermatologist, but it's a part of their profession that they have to promote certain products, and they do that. But don't get into that trap of buying new things, because you cannot experiment with your skin on an everyday basis. You'll have to stick to
Right.
products which have good scientific data. Also, these products which are available at cosmeceuticals and things which are just available over the counter, most of them contain fragrances and added preservatives and other
Mm.
ingredients which actually damages the skin barrier more than preventing any of that. And never choose these products, because in the long run these fragrance products can actually damage the skin much more than you know. So stick to
Mm.
products which are simple. Your dermatologist will always tell you products which are simple, have good data, and work well for the skin. Choose all of that, and never ever choose products or just at the glimpse of you like it or you want to use it, because it might not just be the best for your skin. So
Mm.
it is difficult initially for you to stick to products, because it's very fascinating to see a good packaging product, but then you have to choose for your skin. It's you who has to decide whether you want to go with the products just because it looks good, or you want to go with a product which has data which will actually make you look good. So it is you who has to be the decider for this.
You're right, right. Now, again, skin, it differs individually. We cannot just look at somebody else's skin and think, काश मेरा भी skin ऐसा होता. और मैं वही products लगाऊंगी जो ये लगा रही है तो मेरा skin ऐसा हो जाएगा. It does not happen like that. Has a lot to do with genetics. So that's not how it happens. You can create the best version of yourself. You cannot be somebody else. You can never be somebody else. So try creating the best version of yourself by doing the basic important things under the guidance of an expert or a dermatologist. So I think that will be the best suggestion or the best thing you're doing to your skin. Now we were talking about food, doctor. Tell us, like you said, water plays a very important role for our skin. Does food also plays a very important role? I mean, do we look the way we eat?
Of course, what goes into your skin is a lot about what goes into your body also, because
Mm-hmm,
if you eat good, if you eat clean, your skin will actually show that difference. You have to include a lot of antioxidants in the food. I'm not saying it should come from the food, because we all know that food nowadays contains so much of pesticides and other things. So it's not about the
mm-hmm,
food per se that antioxidants are there. I always nowadays, instead of focusing so much on the food, I actually focus on a lot of supplements which are antioxidant in nature, because these are better in the way that they don't have chemicals and pesticides in them. We don't know how much of the food that we really get nowadays is well grown and free of chemicals and pesticides. I don't think even one of us consume that kind of a food on everyday basis. So
mm-hmm,
food is important, but more than the food, we are focusing on the antioxidant. So either a
right.
supplement or food,
Mm,
either of them, but a good antioxidant has to be there in your everyday diet. That is important. Other than that,
mm,
there are very easy things, like there's something called as butterfly blue pt. which I
Mm.
usually consume on an everyday basis, it's very rich in antioxidants. So this is something which I do, and it's not just food. It's just a dip tea which I consume, and it actually helps a lot. So you'll have to find things which work. These can be either in the form of food or otherwise, but you have to add antioxidants into your diet. This is very important.
Right.
Talking about, you know, other than this, I feel that uh, consuming water is very important because water hydrates
Mm-hmm.
the skin. And other than that, I don't think there's too much about food to your skin. But yes,
Mm-hmm.
antioxidants and water, these are two things which should be there in your routine.
Right. Supplements also you mentioned, doctor. What kind of supplements can you please give us a thing or two?
So, depending on your age and depending on the skin quality that you have, there are different kinds of supplements which can be taken. Sometimes vitamins and minerals, even certain supplements like pycnogenol. Even sometimes other supplements, for example, NAD, or different kinds of supplements, collagen supplements available. So depending on
Mm-hmm.
what kind of a skin you have, what age you have you are at actually, and depending on the kind of lifestyle that you have, different kinds of supplements are available. So it's best, out of all of these, what you need will be best suggested. It is a customized treatment approach that I usually do. It's not that one supplement is good for every single person. It's a customized approach. So depending on all of these factors, I choose which supplement should my patient be taking, and that is how I go across it.
Right. Very well. Doctor, quickly, I can see a few questions coming up from the viewers. The first question comes from Abhishek Sen, who asks, do moisturizers help improve the texture of rough, dry skin?
Very well. If you've asked this question, I'm sure you know the answer to it too, because yes, moisturizer is something which will make your skin soft, supple, and of course, it improves the skin texture. If you use it on a regular basis, these fine lines and wrinkles and uneven skin texture also gets evened out. So yes, it's a complete yes from my end.
Right. The next question, doctor, comes from Sonia Sahu, who asks, do moisturizers with vitamin A, C, E provide additional benefit to dry skin beyond hydration?
Um, I'll just like to tell you that most of these vitamin A, C, and E, in case these are just sometimes these are actually not that beneficial when just applied to the skin, until unless these are encapsulated in formulations that it can get absorbed into the skin, because we want these formulations and these vitamins to get absorbed. Sometimes the formulations available do not have the supplements which actually help in absorption of these vitamins into the skin, so it might not be effective. But yes, in case the formulation is well formulated and it gets absorbed, it will help in making your skin feel better. Of course, more than this, I'd suggest you, in case of a moisturizer, look for agents like ceramides, look for shea butter, mango butter in case of body moisturizers, look for
Mm-hmm.
squalene. These are the agents which are more beneficial when it comes to a moisturizer.
Right. Now, because you are speaking about the moisturizers, doctor, any particular moisturizer you would like to swear on at this moment?
So, this is a very unique product which I have come across. It's a moisty lotion which I do recommend to a lot of my patients. It has the correct amount of different things which is needed in a moisturizer, like how we say a ideal moisturizer
Mm-hmm.
should be hypoallergic, non-comedogenic. It should be pocket friendly. It should be
Mm-hmm.
appealing to the skin. It should get absorbed well. So I think all of those features get covered with this moisturizer, and that is how I do recommend this for a lot of my patients. And it's available widely, so that is why I think that there's going to be no issues finding it. And yes, that's how I recommend.
So what would that be? What would that product be?
That product would be Moisty Lotion. That is the product.
Okay. Well, we had a wonderful discussion on the topic, and we got to learn a lot of new things from you, doctor. We are totally delighted by your presence this day. Thank you so much for the wonderful session. Before we take a leave, any take home message for our viewers who has watched us so far?
Okay, so we've talked so much about moisturizers. I'd just like to say one
Mhm.
single thing. At the end of this, I feel that you've been convinced that you need a moisturizer. So go back, purchase a moisturizer and start to use it. That's the only way I will feel that you've been benefited in a way, because it's needed for every single person out there. No matter you have dry skin, acne
Mm.
skin, atopic dermatitis, psoriasis, or you don't know what kind of a skin you have, you still need a moisturizer. For more information on the particular moisturizer that you should be using, consult a dermatologist, because that's the best way to start using a product, is to know your skin and then start the treatment. So consult a dermatologist and get into that habit of using a moisturizer, because it's going to make your aging less faster, and it's going to be a good anti-aging for your entire skin. So yes, you have to start using it. That's it.
Well, that was the expert advice for today, and that was Dr. Harsha for us. Thank you so much, Doctor, for your valuable time. It has been a very informative session for our viewers today, and we look forward to many more such sessions in coming time. And it was also great to hear from you. We are really looking forward to many more such sessions with our viewers in coming time. Also, thank you, viewers, for your excellent participation in today's session. For more information and update, stay connected to our channel, Radios with You, issued by public interest by makers of Nulibor Lotion Advanced Genetics Division of Hetero Healthcare. Thank you. Stay safe and stay healthy.
Thank you so much.